Joining us now, former New York City Assistant Commissioner of Health and host of the Epidemic Podcast, Dr. Celine Gounder, and Dr. F. Perry Wilson, Associate Professor of Medicine at Yale University School of Medicine. Dr. Gounder, you just heard the president. Are we winning the war?
Well, if you consider winning in terms of rising numbers of cases, infections, hospitalizations, and deaths, I guess we have the highest numbers of any country in the world right now. So perhaps on that level, we're winning the war. But that's certainly not the metric that those of us working in public health and medicine would be judging by.
Right, or any American for that matter who is concerned about their own safety or that of their family members and friends and neighbors and even total strangers. Dr. Wilson, I'm just struck by the images we've been seeing nationwide, the long lines of cars waiting to get into coronavirus testing sites, not to mention stories of people who do get tested and then have to wait 7 to even 10 days just to get their results. How is this still a problem months into the pandemic?
I will be fairly upfront about this. I think the problem is essentially a complete abdication of federal leadership. This was something we needed the federal government to start working on in January when we knew this was going to be a major problem. And there has been essentially zero central oversight of any of these processes. There has been inadequate effort to ramp up testing. And let me point out that the reason we need so many tests right now is because we have so many cases. If you had, a minimal outbreak, well, you wouldn't need this many tests. We are in the bad shape that we're in because this disease was not managed appropriately at a federal level from the beginning. You can't simply rely on each state to go their own way on this.
Dr. Gounder, the New York Times is reporting that the very week President Trump demanded weaker guidelines for schools to reopen, his experts behind the scenes were warning that fully reopening schools and universities remained the highest risk for the spread of coronavirus. But the CDC director said this.
And I think it's important, unlike influenza, where one of our biggest concerns is we've been able to show that it's really schools and children that become the instrument of transmission throughout our community. With influenza, we really don't have evidence that children are driving the transmission cycle of this.
What are we, as parents, supposed to think?
Well, I do think that needs to be qualified. So, and I actually have a Twitter thread from a couple days ago where I go into this in much more detail than we can talk about right now. But what we have seen, both based in terms of basic science as well as the epidemiology, is that children under the age of 10 and under, are really not the drivers of transmission. So not all children are equal in terms of COVID. But if you're talking about school reopening, first of all, you absolutely cannot reopen schools as long as there's widespread community transmission. But even when you do, I think there are ways to do this in such a way maybe elementary school kids are prioritized for in-classroom teaching, whereas older children who are higher risk for transmitting to adults, as well as for being infected themselves, that they might be prioritized for virtual school teaching.
Those are some good options, certainly. Dr. Wilson, let's talk about Florida for just a moment, where right now over 10,000 new cases are being reported in the last 24 hours. The state had 2 days over 11,000 new cases this week, but the governor won't issue a statewide mask order. What's your reaction to that?
It is mind-boggling. This is the single number one public health intervention that has been shown not just in other countries, but in our country, in various states, to drive down the rates of this epidemic. And I assume the governor wants case rates to go down, that he wants people to feel comfortable going out in public and shopping and driving the economy. That you would avoid such a simple intervention is really hard to explain. And I hope the people of the state of Florida have more common sense than the governor in this case.
There's a very, very troubling new study that finds coronavirus doesn't just damage the lungs, which we've reported so much on, but it's also the kidneys, the liver, the heart, the brain, the nervous system. To both of you, Dr. Gounder, you first, what has surprised you the most about this virus? And do you think this information is breaking through to people?
Well, we've known actually for a couple months now, at least, that the coronavirus causes disease through massive inflammation, dysfunction of the immune system response to the infection, and blood vessel damage and clots in the blood vessels. So that's something we've known. What that means by extension is that every single organ system in the body is at risk for damage. I will say, as somebody who's been an infectious disease specialist for quite a long time now, have worked in the U.S. as well as overseas in Africa and so on, I've seen a lot of infectious diseases and everything from HIV to Ebola, and I have never seen an infectious disease that can cause quite so many kinds of clinical presentations, so many kinds of disease as coronavirus.
And to you quickly, Dr. Wilson.
Yeah, I totally agree. One of the things that terrifies healthcare workers like myself who are caring for patients with coronavirus is that diversity of presentation, from literally the sniffles or even completely asymptomatic to ventilator-dependent respiratory failure on cardiopulmonary bypass. And I've seen both of those presentations in a wide range of patients, including young patients without comorbidities. That diversity of presentation is really scary for all of us.
Dr. Wilson, Dr. Gounder, my thanks to both of you. Always appreciate it. Coming up, their hope in 2016 was to make sure their own party's nominee didn't become president, but it didn't work. But now the never Trump Republicans are back. So what's their strategy this time around? That's next, live in the CNN